Dr. Seema, tell us, people are usually advised that women after delivery should not be in air-conditioned rooms and should also keep themselves warm as well as their baby, just so the concept of hawa na lag jaye doesn't take place. What is your take on this concept?
To be frank, I feel very sorry for those women who have been advised such a thing, because to cover themselves in this heat and that too with woolens, and it's really unimaginable, but a lot of women actually go through this, and they're advised not only to not use ACs, but they switch off their fans as well, and they feel that hawa lag jayegi to shareer kacha ho jayega, or they will fall sick faster. But really, medically, there is no rationale to it. It should not be done, because with increased sweating you might have skin problems, you can have rashes, you can have itchy skin, you will be very irritable, and the same would go for your baby as well. So I would suggest to everybody to just listen to themselves, just feel comfortable, wear comfortable clothing, and by all means have fans and ACs on. It does not hamper their recovery in any way. On the contrary, if you are sweating all over, you might have problems with your stitches. So just keep dry, keep cool, and be comfortable. You've already had a bad time after delivery or after cesarean, so don't prolong your misery and don't add to your agony.
One commonly hears that ladies are advised not to take a bath for about a week or so. Is there any relevance to this practice, or is this just an old wives' tale and a myth?
It's definitely not good to not clean yourself for such a long time, especially when after delivery you're going to be bleeding and so many bodily changes are happening. A lot of people feel that they have their own customs. Some families would say don't have a bath for 7 days, some would say 11 days. You don't go out of the house, you don't have a bath. I don't know how this practice started, but if I reflect back, maybe in olden times we did not have access to clean water, and people did not have access to even a septic delivery. So maybe their wounds were all raw, and they felt that if you would apply dirty water on that, maybe your wounds would get infected faster. So to stay away from that infection, maybe women were advised to not have a bath, but I don't think that should apply in today's time. So medically, all women are advised to have a bath every day straight after the delivery and even after the cesarean. Don't wait for your stitches to dry up, because that would usually take around a week, 10 days. But these days we have washproof dressings which keep your stitch line dry, so you can have those dressings on, and you can just have a bath without making your stitch line wet.